Since I'm a urologist and I deal with conditions of the kidney, bladder, prostate, common conditions I treat is kidney tumors, kidney stones, bladder cancers, prostate problems, prostate cancers, and since today we're dealing with only with men, but women too. So symptoms like for kidney stones, most common symptom would be like somebody with flank pain, blood in the urine. Sometimes they'll come in with they usually come into the emergency room with severe pain, nausea, vomiting, blood in the urine. If we're dealing with prostate issues, sometimes they'll have trouble passing their urine, controlling their urine, blood in the urine. In women, of course, they have some issues with incontinence. They have trouble controlling their urine. Those are some of the common conditions that I treat. Prostate-specific antigen is a protein that is produced in the prostate gland, and it's specific to the prostate, but it's not cancer specific. So the PSA could be abnormal. That doesn't always mean it's because of prostate cancer. So then if somebody has an abnormal PSA, I do a prostate biopsy in the clinic to check if they have prostate cancer or not. And what the controversy has been around is that should all men be having PSAs or not? And we know that all men do not need to have PSAs done, but we try to focus on the groups that are higher risk. Like if somebody has had a family history, brothers, uncles, dad had prostate cancer, we definitely want to screen them. Or in men who are in the 55 to 70 age group, because those are the men, if they had cancer, we can cure them. The thing is that because prostate cancers are slow growing, if somebody is late in their 80s or 90s, we don't screen those patients because they are likely to end up dying of some other condition like a stroke or heart attack, and usually prostate cancer are slow growing cancers. So usually we focus on somebody with family history. Also, African American men seem to get cancers more often and more aggressive, so those are the ones we want to concentrate on. And so we kind of select the patients that we want to PSAs and not random screening on all men. The pill that you're talking about is a pill called finasteride or Proscar, and the way it works, it shrinks the size of the prostate. But that doesn't always mean it's going to get rid of the obstruction. The reason we are treating it not just to shrink the size, but to get rid of the blockage that the prostate produces. And the pill works better for men where the prostate's extremely large in size. If they're not very large, they don't always work, and also they don't always correct the condition. So we can try the pills first, but if they don't work, then the last resort is surgery, the TORP you're talking about. The surgery involves removing the blockage, because that's the problem, that there's a prostate gland is enlarged and is blocking the urine flow. It's a mechanical obstruction. So I can go into the scope through the natural passage without making incisions from outside, and I can basically remove whatever blockage there is by cutting out the tissue, and that fixes the problem. One thing that has changed our treatment a lot is the discovery of Viagra for erectile dysfunction. This is about 20 years ago. Before that, they did not have that option, and then we would be doing more invasive types of treatments. But with the advent of Viagra and now other pills like Levitra, Cialis, it's a less invasive way of treating erectile dysfunction. And although it doesn't work for everyone, it is definitely the first thing that we go to. The other thing I can think of in urology, and this is not specific to men and women too, with kidney stones. Before, I'd say more than 30 years ago, we had to do open surgery on all kidney stones. Now we have a lot of different equipment available, like we got nice scopes with which we can go in without making incisions and either breaking the stones up with a laser, or we can break up the stones with a shockwave machine, which is from outside the body. So it's a lot less invasive. So that has really helped a lot, because these patients had to, after open surgery, stay in the hospital for a few days, recovery about 3 to 4 weeks. Now they come in, we deal with the stones. If they're outpatient procedures, they go home the same day, and they're back to work within a week or two. Usually they'll come in complaining of not being able to have normal erections for intercourse. Sometimes they'll come in with problems with ejaculation, like premature ejaculation. but most commonly it's for erectile dysfunction. They are not able to have either not be able to have a normal erection, or they can have an erection but it doesn't last long enough to be able to have satisfactory sexual intercourse. The most common reasons why men have erectile dysfunction is aging process, very common in diabetics, very common in men who have high blood pressure. If they've had some surgeries that have damaged the nerves to the penis, or blood supply, or anything that has to do with the nerve supply, can cause problems like this, or hormonal, like if the testosterone level is low, sometimes that can cause problems like this. So then after talking to them and getting their history and physical exam, we kind of find out what's causing that problem, and then we can do some testing to find out what can be done to fix the problem. Okay, one thing that I'd like to mention is in young kids, like college kids, like for 15 to 35 age group, the most common cancer we see is testis cancer. So that is something that I think people should know, that if they notice a lump that was not there or something abnormal, they should go see their physician right away, because a lot of times there are cancers that can be cured if they're caught in time. What happens is that the testis cancers, when they spread along the lymphatics, along the cord, go up to the groin, and they go into the abdomen. So I do what is called a radical orchiectomy. What that means is removing the testicle along with the spermatic cord where it goes into the abdomen, because we want, if it has spread beyond the testicle into the cord, we want to get all that. And then, of course, we send that into the lab. We see what kind of cancer, but there are different kinds of testis cancer. They're not all the same. And then we can stage them, like we can do a CT scan to see if it has spread into the abdomen lymph nodes or not. And there are some blood tests we can do called tumor markers. And from that, we can tell if we got a cure or not.
Thank you.
All right.
I'm aware that the self-exam is important, but I never had thought to ask about when it is diagnosed, what's next?
Yeah, the first thing is you got to take the testicle at the cord out, and so we get a good pathology report as to, because it's not always one cancer. It can be a combination of 2 or 3 different kinds of testis cancer, and the treatments are different. So based on the pathology, the treatment is based on that. Yeah, there are kids. In kids, I see them. Sometimes they're not born. They're one testicle or both. Sometimes they're not descended. So the testicles develop inside the abdomen. They don't develop in the scrotum. And so just at or shortly before birth, the testicles come down into the scrotum. And if they don't, then so I can do surgery to bring them down into the scrotum. Because if we don't bring them down, they have a higher risk of getting infertility later on in life. Also, these testicles are more prone to get testis cancer later on in life. So if they were left in the abdomen, you would never know, because you can't feel it. But when the testicle is in the scrotum, and if they develop a lump, you can find it and diagnose it earlier and treat it. With PSA, like we talked about, screening for prostate cancer, to detect them, that's the only way to detect prostate cancer early, is by doing a PSA blood test and an exam of the prostate. Because if we don't screen them, a lot of times when we diagnose prostate cancer, it's too late to cure them because they already spread. And the only way to do that is by doing the PSA blood test. Because if it is abnormal, then I do a biopsy. And then the biopsy tells me, first of all, if it's cancer or not. If it's a biopsy, if it's a cancer, what grade the cancer is, how many of those biopsies are positive. So based on that, we can decide the treatment plan. Like if it's a very low-grade cancer, a very small amount of cancer, sometimes these cancers are so slow growing, we don't absolutely necessarily have to treat them right away, but we can watch them. And if we see that they're progressing, then treat them. Because any treatment you do for prostate cancer, like surgery or radiation, can cause side effects. Like with surgery, you can get incontinence issues, erection problem issues. Radiation can cause some side effects too. So if we can avoid or at least delay them, then that's the way to go. Presently, the guidelines by American Urology Association says that between 55 and 70, we should discuss with the patient. We don't necessarily have to, but tell them what are the pros and cons of doing it. that to the only way to diagnose prostate cancer is by doing the blood test and exam. But then we also tell them that just because it's abnormal doesn't mean it's cancer, but we have to do a biopsy to find out if there's cancer or not. And with biopsies, I've been doing prostate biopsies for over 30 years, and most of them, 99%, they do not have any significant complications. But sometimes you can have complications by doing the biopsy itself. Like you could have infections and stuff like that. So as long as the patient knows what the pros are, what the cons are, what is the advantage, disadvantage of each, and they want to know if they have prostate cancer or not, then we proceed with doing the prostate biopsies. But especially if they've got a family history or they're African American, then I definitely will recommend doing it, because there's a prostate cancer gene. It can be passed on genetically. And if there's a family history, there's a very high risk of getting prostate cancer. And if you're going to get prostate cancer, you want to catch it early when you can cure it. Well, there is a very good site online, urologyhealth.org. urologyhealth.org. It's run by the American Urology Association Foundation, and it's meant for urology conditions for the general population to read about it. What are the symptoms? What are the common conditions that urologists treat? And that's a very non-biased, very well researched site. Or you can go to the AUA site, or like I said, urologyhealth.org. That's run by the American Urology Foundation for knowledge for general population. Because a lot of times they'll go on Google and they'll get all sorts of conflicting information, and most of it is wrong and not pertinent to what they are looking at.